I want to talk about USAFacts because, as I said, you've been doing a public service with this website, really putting a lot of numbers together. You've now created a new recovery hub that's really looking at the COVID-19 pandemic that we're living through, but also trying to take that and really add the numbers and crunch them together. What's the biggest surprise that you've noticed in terms of the data thus far?
Well, I'm going to list a couple things. Everybody knows the stimulus is large. Most people don't recognize we have already spent 1/4 as much just on the stimulus as we spent in our entire government spending last year. We spent about $4.4 trillion this year so far as a country. We've already, by August 1, spent over $5 trillion. It's really remarkable. Now, maybe not surprising, but if you put it in context, you can go, whoa, that really blows my head back. And yet there's still things we don't know. We don't get, this is a lament for mine about government data. We don't get real-time government data from our state and local governments. One of the debates in the next stimulus package is how much support, if any, do those entities need? Sorry, I wouldn't know how to form an opinion. And as a citizen, I'd like to form an opinion based on the data. You know, if you take a look at what's going on in people's lifestyle, the truth of the matter is that spending is up. Income is up by about 5%. Spending's down about 8%. Now, that's remarkable because what it says is the savings rate of our country has gone from 8% to 19% over this period of time. Wow, quite remarkable. And yet we still don't know for whom life has changed. Sorry.
Right. So, but what I was just going to ask, the takeaway on the distinction between those two numbers, almost a contrarian in terms of what I think we would have thought initially. What does that say about, for example, this $600 stimulus plan or $600 a week unemployment insurance plan that is now back on the table? Do you think that we need it? Do you think we don't need it? What is the lesson, the takeaway of these numbers, you think?
Well, of course, we, as I said, want to be able to dive deeper. My intuition looking at the numbers is we really should be well targeted at who gets 600 and who does not. If we had the IT systems in place, what we'd really want to do, I think, we don't have all the data, is target people at the lower end of the income spectrum. You could say it might get them above their earnings, but we're talking about people for whom this might represent just above subsistence level if they were provided the money.
Right. Steve, as somebody who's now spent a lot of time looking at data and actually working the data behind the scenes because you're crunching it and taking it from different various sources, how much would it cost us to get good data? Part of the problem we have, as you keep mentioning, is we have bad data in this country. We have This is also a testing issue, by the way, for COVID. We have bad testing, so we don't have good numbers. Therefore, we can't do good tracing. What do you think the cost, and I'm not talking about the cost necessarily of testing per se, but the cost of getting the right kind of data that you're looking for so that we can make educated decisions really is?
I think there's a whole lot of improvement that is just about free. I think if the purpose of our statistical agencies was actually to help decision makers make decisions, as opposed to just provide economists a mass of data for analysis, I actually think we could make incredible progress for essentially nothing. Second step would be to make the IT work harder. I don't think this stuff is necessarily as well automated. And number three would be to publish it in a much more understandable form. Then on top of that, I'm sure there's money maybe that needs to be added in. But, you know, like any businessman, let's go get the low-hanging fruit. Might get us 80% of, the way to where we need to be.